Let's go ahead and get started. Sarah, do you want to give us just a little bit of background about yourself and the work you've been doing with Lead-Free Delaware?
Yeah, I've been doing work on lead for about 4 years now, since 2016, when I had a personal experience with lead near my home. But I've been doing working on health and the environment for over 10 years. So I'm excited to share this stuff with you today because everyone's at home right now, and we know a lot of kids are at home in homes that have lead paint. So I feel like this is really timely information.
Yeah, the Sierra Club's been doing book studies on different topics, and Sarah, you've joined a number of those, and our last one was all about how our environmental justice issues and chemicals that we come into in our daily interactions, and of course lead has an impact on IQ and behavioral health and other mental health issues. And so this was a really kind of a pertinent conversation to have coming out of that book study. If you guys haven't read the book, A Terrible Thing to Waste is a fantastic book, and I highly recommend it, and hopefully we'll be able to explore more of those topics as we go along. So I appreciate all the work that that you and Amy and others have done in terms of trying to take care of the lead situation here in Delaware. What are some of the initiatives that you've taken on over the past couple years on this?
So I'll just briefly go through. I'm going to share my screen just so I can just show you a couple of those things. So when we first got started, we were really focusing on outdoor lead. We were really focused on lead from bridges, lead from water towers, things like that. But we've gotten into much more. Can you see my screen okay?
Yep.
Okay. So yeah, when we first got started, we were working really on outdoor lead. We're actually a coalition of groups. So Lead-Free Delaware isn't its own nonprofit. It's actually just a coalition of groups. We've got one goal: get the lead out. We just want lead out of Delaware's people and our environment. We want it out, we want it gone. And we found most people agree with that sentiment. So this is just an example of the groups we've worked with. This was a letter we wrote to the Joint Finance Committee. And we work on anything really lead related. We are volunteers, so we're not employees, and we just find stuff that needs to be worked on and we try to work on it. The first thing when we started looking at lead, we found that we were really surprised because we know lead's in homes that are old, but we were really surprised to see how much lead was still allowed to be applied outdoors on bridges and things like that. So the first thing we did was we wanted to ban lead paint outdoors, and no other state had done it. We talked to some international groups, actually some groups out of California, and they said good luck. They didn't think we'd be able to do it, but we became the first state in 2018 to ban the outdoor application of lead paint on structures. Another thing we found out in looking at lead poisoning is that there was no committee meeting. The state had actually put together a work group that was supposed to be meeting until the rate of lead poisoning had dropped below a certain percentage. It did not drop below that percentage, but they stopped meeting in 2012. So last year we worked on restarting that committee with expanded stakeholders. And there is a report coming out this year from housing experts, from people in education, from people in healthcare. It's chaired by a pediatrician. So we hope, even with coronavirus, that report is still slated to come out. We've heard it is. Another thing we've been working on is just getting our lead testing increased. And I guess I hope the one thing that comes clear from this discussion is that, you know, everything's connected. Environment and health, it is one thing. So when we talk about, you know, this person's an environmentalist, this person's a health person, it's all one big connection. So when there's lead in the environment, it ends up in our bodies. When there's lead in animals, it ends up in our bodies. So one of the things, obviously, ideally, we would get lead out so that people weren't exposed at all, especially children. But until we can get there, we've had decades of application of lead paint. We've had decades of using lead in gasoline. Those things went well through the 1970s. So we have a lot of legacy lead in our environment. So we want to test kids so that when they do have lead poisoning, that we can identify it, get them away from the source, and start getting them early intervention. Because while lead poisoning is a permanent, it's irreversible, we also know that kids' brains are really, they have a lot of plasticity. They can benefit from early intervention. So it's really important. It's not one of those things we just find it out and, oh, well, that's that. We find it out and we can actually make some inroads, especially the younger we find out kids are lead poisoned. We also worked at getting permits for sandblasting of water towers, which have lead paint on them. And we worked on actually, through our work, we actually found some homes that had lead in their yard. And we actually worked to get that yard remediated and some additional regulations in Newark around outdoor structures. And Dustin, I'm going to count on you to tell me if there's any questions coming in. Just jump in.
Yep.
So people are like, well, you know, we've all been exposed to lead. We're fine. The main thing is there's no safe level of lead exposure. And it's really kind of frustrating work because we can't point to when something happened and say, this is the outcome. It's not clean. Most things in environmental health aren't clean like that. We can't point to a specific event and a specific outcome. And that makes it really hard. And it makes it really hard to work on because people almost, as you see with current health issues going on, it's very hard for people to connect things if they don't see it right in front of them. But we know that lead affects everybody. It affects adults. Unfortunately, Delaware doesn't participate in this national database for workers who are exposed to lead. We are trying to change that. But especially for children, it affects brain, it affects kidneys. And what happens is once it enters your system, it circulates in your blood, and then it goes to your brain and your fatty tissues and your kidney and your bone. And some of it, whatever lands there is permanent. It lodges there. So it stays there. So you can test negative for blood lead levels. And if you haven't been exposed recently, that might be because it's already been stored in your bone. And the problem with when things are stored in your bone is they get released as you age. They also get released when you're pregnant. So things, early life exposures can really come back to show themselves during other times in one's life, like pregnancy and aging, when those bones are breaking down. We also know that even really mild exposures to lead affect a child's trajectory in their life. And Dustin, you talked about this book we read, and I really recommend this book, A Terrible Thing to Waste. It's so good. And she talks about how really small exposures to things like lead, which really aren't, lead is obviously found in the environment, but the way that we encounter it in today's modern society is pretty unusual compared to historically. You know, the fact that it can be found on toys, it can be found on the lining of our food bowls, all these things where historically we most likely would not have been exposed before, like industrialization. And these really have an impact on people's brains. And what you'll see as we go through, unfortunately, it affects some people more than others. People who also have other disadvantages going against them already. So as you can see here, it can lead to behavioral issues. And one of the things that at Lead Free Delaware we've been advocating for is getting blood lead test monitors in school nurses' offices so that they can do blood lead testing right at the school, so that when children have behavioral problems, we can look at lead and just make sure there's not any acute lead poisoning going on. We can rule that out. Because the last thing you'd want to do is treat something like lead poisoning in a way that doesn't first address the lead poisoning. So everyone always says, like, why are we still talking about this? I was born in 1978, so, you know, it feels like a while ago for most people. That's when it was banned indoors. Unfortunately, the repercussions of lead being in homes has continued. Our housing policies in the United States, a lot of our health, our government policy, our housing policy has really impacted the continuance of these old homes being continuously used for families with small children. So the old housing definitely remains a very big threat. Even through 1986, we saw lead being used in pipes. You probably heard of this during the Flint crisis when the corrosivity of the water changed, lead in those pipes was then released. And we know outdoor lead can still be applied. We actually did a kind of a study when we first started doing our work with lead. We tried to buy lead paint. We bought it. We bought a big gallon of it from Home Depot. So it can be applied on boats. It can be applied outside. In Delaware, we now have restrictions for that, but it's easy to get and it's easy to mistake for other types of paint. People probably have old cans lying around of it. There's also all these other exposures now that we're finding more all the time. Certain art paints have lead in it. We know that people who do recreational marksmanship, some people have to go to the firing range for their job, police officers and things like that, they can actually track home lead dust on their shoes and their clothing and their hands if they don't take the proper precautions. So one of the things that actually in Lead Free Delaware, we spoke to the hunter safety course at DENREC, and they have actually implemented some education around that right now. And there's all these other unknown exposures. As this book talked about, so many things that we think are regulated are not regulated in the way that we think they are. Out of all these 80,000 chemicals that are in our current environment, very few are regulated, and if any are banned. I think there's less than 5 that have had any restrictions. Even asbestos is still not banned. So there's a lot of things out there, and I think people believe that perhaps more has been done around some of these issues, but it hasn't.
So Sarah, we had a couple questions I want to answer for those watching on Facebook that are not seeing the chat. The author of the book we keep mentioning is Harriet A. Washington. So A Terrible Thing to Waste by Harriet A. Washington. And we had a couple questions from Facebook. One of them I know you're going to get to in a little bit, which is what can legislators do? But one that I think is pertinent to where we're at now, well, two. What would constitute a small exposure? How much lead would that amount to? They put quotes around small exposure. And then the other question that you may get to in a little bit is, are there products coming from other countries into the United States that still carry a lot of lead? Is that a current issue?
So the second question about products coming in from other countries, there are some state policies that attempt to address these. In Delaware, we have a piece of legislation that looks to address that. I know a couple other states do as well. I don't know how effective the legislation is, just considering all the different sources that come in, and how a lot of times those type of regulations have a lot of difficulty in being difficult as far as enforcement. So I would say that from the studies I've looked at, that there's certainly plenty of things coming in from overseas, but that's not to say that there certainly aren't things here that are as well. We know there's lead paint in, for example, stripes on the roads, those yellow stripes that you put on the curbs. So it can come from either direction. The first question about what can legislators do, we really need testing in Delaware. We are behind. We are one of the only states on the entire East Coast, except for West Virginia, that does not do significant lead testing. Most states have gone either to 1, 2, some states have 3 and 4 year testing. They have very robust data sets, and they've been really able to hone in on these high risk areas. And the problem is in Delaware, we don't test enough kids to even know the high risk areas. I was just getting ready to go into how our testing rates, we have a state law that says all children must be tested at age 1. Well, right now we have between 43 and 44% of kids getting tested. That's abysmal, and that is not good. We need, only 1 out of 5 kids are getting tested before age 6. That is too late, because 90% of your brain develops by age 5. We need to get detection early. So we need testing, we need it frequently. Of course, ideally, there would never be exposure in the first place. I will be the first one to say, I wish I could do something other than this, because I wish lead poisoning didn't exist, but it does, and that's where we're at. So being that that's where we're at, we have to test kids. And that is the one thing, if you come out of this, what can legislators do? Increase testing. Because we have providers who don't have finger stick testing. They're sending people home with a lab slip, and then the family maybe doesn't go get the test because they don't want to strap down their 1-year-old at LabCorp. And it's very complicated, and it could be made very easy with these finger stick monitors, with school nurses having the supplies that they need. It's really just infrastructure and buy-in of the pediatric community. Unfortunately, the way we have it set up in Delaware right now, we have this questionnaire that so you're supposed to test kids for blood lead levels at age 1. And then at age 2, you're supposed to do a survey. And it asks the parent or guardian their exposure to lead. And unfortunately, as you've seen, it requires you to know a lot of things about your lead exposure that you really just can't know. I lived next to a water tower. I really wouldn't have known that had lead paint in it if somebody didn't tell me. And I had to ask to find that out. So there's a lot of exposure. Just do the test, and then if you test above a certain level, we can actually provide you federally funded services like Head Start and kind of get that kid back on track. So I think I answered that question.
Yeah, the only other question was, what would constitute do you have a kind of a measurement on what would be a small exposure?
I don't have a specific measurement for that. I do know that the amount that's found in like a sugar packet is enough to poison a very large area. That amount sprinkled out over like a field can, lead to, you don't need a lot. It's kind of like, I would equate it to something like, it's kind of like drinking while pregnant. There's not a safe level. Nobody's going to tell you that's a safe amount. The lower you go, the better. The lower your lead exposure is, the better. But there's no amount that's safe or small. Right now, the way it works is the CDC's level of action is anything 5 and above is considered a level of concern. So if you do a test, a blood lead test, and you get a 5 or above micrograms per deciliter, that's considered an action level.
So I'll let you continue in the presentation here, but I did not know there was lead in the paint that's on the roads, and I'm like, my brain just exploded just on that one thing. So, but I'll let you please continue.
Well, actually, and what's actually really scarier is that our paint actually has very small levels of lead in it. There are permissible levels of lead for it to be considered a leaded paint. So that's a whole other story, but it's surprising to see how much lead is out there when you actually start looking around. So yeah, like I just was saying, there's less than half our kids in Delaware are receiving this blood lead test as required by the state law. And while that was put into law in the 90s, there was some discussion later on that we should focus on high risk groups, and absolutely we should, but we really need everyone tested because there's plenty of people, they just don't know their exposure level, and this is a really easy way to find out. It's just a finger prick. And like I said, we have not had a state committee looking at this issue since 2012. When we were in Legislative Hall last year, we were really surprised that Colonial School District was really supportive of blood lead testing in kids at age 2. And they were finding that 25 to 33% of their students are arriving to kindergarten without ever having a blood lead test. Now, it is a requirement to enter school to get a blood lead test. But like I said earlier, we don't want to be testing kids at age 5 and 6 and, having missed all those years that we could have intervened. Because there's actually a significant amount of blood lead exposure that occurs as kids start moving. So at age 1, you may not find something, and at age 2, when they start putting all things in their mouth and touching your walls, you might find it then. So these are just the statistics, just to let you know, we got these from Public Health. This was the number of live births and the number of children that received blood lead tests in 2016. And it should be really close to 100% if we were adhering to the state law. And we had spoken actually with Kids Count and they, doing their amazing data collection and research, they found that only 1 in 5 kids in Delaware gets tested before age 6.
Is this
So,
a test that, sorry, is this a test that any parent can demand at any time, or is this something that has to be ordered?
so I know personally, I've asked for it numerous times. I've talked to public health. Most insurance plans will not ask any questions. It's absolutely covered by programs like Medicaid. It's actually required to have to have a 1 and 2 year test if you're on Medicaid or if you receive certain state benefits. So public health has said that they have not heard of cases of it being turned down. It's a very low cost test, and you can just ask for it. And if you're at a certain provider, like lots of the Nemours providers have the machines right in their office, and you can get it done there. So it's super easy, and especially when you consider what you can prevent by getting it done.
Kind of sticking on that for a second, what are the barriers to children being tested in PCP offices, i.e. the finger stick and this abbreviation I don't know, CLIA?
Oh, yeah, okay. So that's a really great question. So a lot of, when we were talking to a lot of providers, they were concerned that they would have to be certified as a lab to do this test. And this is a very simple test, and you actually have a waiver. So doctors' offices do not have to be considered a lab. Any doctor's office, they can get one of these machines. They're between $2,000 and $4,000. And then they just, do this finger stick testing. So they don't need to be considered a lab. Any provider can have one of these machines. We've actually advocated to the General Assembly to get these machines into every pediatrician's office. Like, this is something that can really make a huge difference if we could, detect these things early.
We got a note that I'm just going to read out for those watching on Zoom. We actually have Janice from Kids Count here with us today. Thank you for joining us. She said, just to note that our lead data also comes directly from DPH, which I imagine is Department of Public Health. Additionally, we're interested in doing some more digging in the data related to this, because we've heard from the Delaware School Nurses Association that they're getting a different, in parentheses, much higher percentage of compliance when they do their kindergarten entry process. So, but another good question that I actually was going to ask as well, does the office need to pay for the finger stick machine? Is there assistance for the pediatricians that want to purchase that machine? I know we're getting way off what we had originally planned to talk about, but that's good.
That's a great question. We've actually asked the General Assembly. Last year there was a lot of extra money in Delaware, not so much this year. We actually asked, and we found to get something like 25 monitors, it was about $50,000, and actually the Childhood Lead Poisoning Advisory Committee made similar recommendations this past year, that they wanted 20 to 40 monitors just put into, especially in places that don't have easy access to big hospitals like Nemours and things like that. It is a cost up front, like any medical device, but there's lots of things like that are, and the state could certainly subsidize those costs, because here's the kicker with lead. We end up subsidizing the outcomes through extra educational issues that kids need help with, through behavioral issues, through the types of productive years lost through lead poisoning. We all pay for it already. The amount of money that is saved through detecting lead poisoning early pays back so much. We were at a conference last fall, and I know there have been numbers run on lead poisoning prevention, and it's something like every dollar that gets spent, like 30 comes back. Don't hold me to that, but it's something in that range, that if you can find these things early, you will recoup economic benefit. I don't like to talk in those terms, but it is a fact. It's there. We know that somebody will pay for it, either with their life, their health, or financially. So I think that's a really great investment of $2,000 to $4,000.
Would have to agree.
Yeah.
So what's this not so pretty map that you got here?
So when we started, public health is sadly under-resourced in the lead poisoning prevention area. I have to be honest, lead poisoning is just not, it doesn't reach the levels of some of the other health issues that we see going on these days. And there's really only a handful of people working on it. And so we did not have any new maps to work with. And we asked public health actually to work on this map, to create it. And so this map reflects only children that have been identified as having lead poisoning. So it's not a great map in the sense that I don't like all the dark red that I'm seeing. I think it's a lot, but we are fearful that it could even be far worse because we know that this is only capturing about half the kids. And that's consistent with other states. There's research showing that most states identify fewer than half the cases of lead poisoning that exist.
And is the, just to throw a random question at you, I see a lot of darker red in and around Wilmington and looking along, looks like kind of along the Route 9 and some of these other areas. Is that older because of older buildings or not having the money from remediation, or any ideas as to, it seems to be a pretty deep cluster there?
Yeah, I've got a lot of ideas. Unfortunately, public health doesn't track the specific cause of all these cases until recently. There is an environmental tracking tool that public health has just started using so that when children get lead poisoning, that they can say, this is from a house, this is from, the soil. Unfortunately, we don't have mechanisms like that now. So it's just kind of ideas. We assume, and this is what public health also says, that this is from old housing. This is kind of this legacy housing contamination that exists. Another thing though, because we're not testing all the kids, these are a lot of areas where our families live that are on state assistance. So it could be an overrepresentation of those kids. So until we get better data, it's hard to say.
Gotcha.
That's what we really want to do. I'll talk a little bit about what Maryland did, where they declared the whole state as a risk area and for 6 years until they determined which areas really needed targeted testing. But this is our most up-to-date map that we have from public health. And thank you, Janice, from Kids Count for mentioning that school nurses are finding different things. That's great news, actually. So these are just the two books that I recommend. One we've already talked about. This was actually, a lot of the book was focused on the racial aspects of lead poisoning and environmental contamination. And during a lot of the cases that have happened, we've seen cases like the Freddie Gray case in Baltimore, where we know that he had lead poisoning. We know that certain situations where people should have had intervention, should have been, had various levels of government, some kind of assistance, and they weren't picked up early. But this quote at the top comes out of that. There was a lawyer working on this, and he said, if rich white kids were getting poisoned, there would be a law in the books that says no lead in houses. And I love that quote because I'm hearing so many things right now about coronavirus and how we need contact tracing. We have all these great plans. And what I would love to see is that same level of enthusiasm about contact tracing and, one child is too many applied to lead poisoning. Because right now in this country, we're okay, at least that's how it feels, with, kids getting lead poisoning. And I'm not okay with it. And I know there's many people who are not okay with it. Nobody I know I've talked to yet has liked lead poisoning. So this is something we can fix, but a lot of times the will to fix it is not there. And I think there's a lot of creative solutions we can come up with, like Maryland has. And the second quote is from Dr. Monahan Atisha. She's the pediatrician from Flint, Michigan. And even she, as a pediatrician, ran into a tremendous amount of resistance from higher ups when she started working on lead poisoning. And I think lead poisoning is super straightforward. Like, there's no safe level. Nobody wants it. It's very clear what it does to your body. But she was saying that if you were going to put something to keep them down for generations, it would be lead. Because lead poisoning, its effects, it affects your trajectory, and then that affects the trajectory of the next generation and the next. And it really creates this intergenerational issues that really could have been prevented in the first place. This is just a chart when we were working on this that we found that a lot of people were saying, oh, well, I had lead poisoning when I was little, or I was not necessarily lead poisoning, but I was exposed. For example, most people who are over a certain age were exposed to lead when they were children, just through lead being in gasoline. But we know that down to 3 micrograms, it affects your test scores in school. So there are now really robust studies with thousands of people, 57,000, very large numbers of kids in these studies. And we know that even those small amounts can impact kids. So that's really good information, because in the 70s and 80s, the average in the country was quite high due to the lead in gasoline. And sometimes that's referenced as we all made it okay. And, and it's, that's kind of relative. So we know that it's not good. This is something that's also we've discovered in Delaware. Delaware has actually taken a really cool step. Up until 2017, we had you had to have 45 micrograms of lead in your blood, which is very high. That's like a chelation level of lead to get any federal services. And in 2017, we decided that if you're 10 or higher, you can get federal help. You can get services. You can get, early intervention. We can put you in early preschool, like Head Start. We can stimulate your brain. And we found that this actually helps children. So when children are identified, they're taken away from the lead source and they're put in these early programs, they can recoup some of the loss. It's permanent, but they can recoup some of the loss, because when you're young, your brain can do good if we can find things out early. This is just a slide that says it is a real lead exposure, if it's 10 or higher, is a ICD-10 code. So, but we need to have the blood lead test to show that. So that's another thing why the blood lead testing is so important. We can't get people the services they need if we haven't identified that they have lead poisoning.
What are some of the, so you just mentioned a couple of the federal assistance if you are diagnosed with elevated levels. Are there any other programs out there you'd like to mention while we're on the topic?
Unfortunately, there's not a whole lot. That's the main one that we've located for young children. In Delaware, historically, due to limited staffing, they really wouldn't send out a nurse until you were over 10 or 15. And, and we know from that prior slide that, down to 5 and below, that there are side effects. There are some states that have, the thing is, we set this at the state level. So we could lower that 10 to 5 and, increase a whole bunch of more kids getting services. So that's really a decision that we can make at the state level. And me and Dr. Amy Rowe have been advocating that Delaware lower that limit to 5 so that more kids get help.
Does that trigger remediation as well? If you test positive and they identify the source as being home, does that open up any federal remediation programs for you, or?
That I do not know. One of the things that's come out of our Childhood Lead Poisoning Advisory Committee is that we don't have a good handle on when homes cause lead poisoning in a child to kind of flag those homes. To my knowledge, that's not happening. So there could be homes that have contributed to multiple children being lead poisoned. And it's come up in our meetings that we would love to see those homes prioritized. There really aren't a ton of abatement programs in Delaware. There is one right now in Newcastle County where there's been $3 million to remediate 130 homes. So that's the current program that I'm aware of in Newcastle County.
Gotcha.
So by setting our level at 10 to get federal services, we're still missing all these kids here in the 5 to 9 range. And we know down to 3, it can affect kids' scores in school. So we would like that to be lowered. All these kids should be getting extra services if they're identified. And this is just basically saying the same thing. We're just not able to provide services for the 66% of kids in Delaware right now. And we could change that if we lowered it to 5, but that hasn't happened yet. But we're excited about it. There's an interagency coordinating council that is really excited, and they would really like to see that level lowered. People who work with birth to 3 population are very excited about that. That just basically says the same thing. Dustin, you had asked me to talk about just some of the environmental exposures. I always like to kind of bring things back around full circle. And one of the things is, you know, as humans, we don't live in this like bubble that doesn't connect to other things. And I always find things about eagles fascinating because this is our national bird. And there's so many cases of eagles being poisoned by lead. We actually, in our work, had spoken to some people from Tri-State Bird Rescue. And since 2015, they had treated 49 birds for lead poisoning. 23 were bald eagles. They were brought from various states. But the idea is that a lot of these birds that eat these piles, gut piles, for lack of a better word, of deer and things like that, that are killed with lead ammunition, that they end up bioaccumulating the lead in their body, and it ends up poisoning the bird. Another scary component of lead and where it's found is something like playgrounds, something that you would think would be very a good thing, you know, get kids out, get kids moving, get physical activity, fresh air, especially now during coronavirus, you want to be outside and distancing. Unfortunately, a lot of these old playgrounds have either lead paint on them, and if they have not been renovated to modern safety standards, they still have a lot of those old lead paint. A lot of the playgrounds in Philadelphia are actually in areas where they had smelters and things where there's a lot of legacy contamination in the soil and in the sides of the roads from lead gasoline. But also, like in Arden, there was a playground that was testing positive for lead. And, you know, there was a lot of discussion about how to fix that. You know, should we paint over it? And the bottom line is it really just all needs to go. It needs to be safely removed, and, you know, the soil needs to be replaced, and needs to be done in a really safe manner by people who have training and certification in hazmat. It's just not something you want kids touching. And unfortunately, the paint on these old playgrounds flakes off and gets everywhere. One of the exposures that is kind of surprising to a lot of people is the exposure to firing ranges. And a lot of people, like, if you don't shoot guns, it just sounds kind of abstract, but there are a lot of professions that actually require people to shoot guns. For example, police officers have to keep up their training and certification. Clubs like 4-H actually have teenage marksmanship competitions. And also hunters who actually use lead ammunition sometimes when they go hunting. So it's a concern for people who consume the meats that from hunting, for anybody around those people who go to firing ranges, especially outdoor ranges that don't have good air ventilation systems where they use brooms to sweep things up. We have some of those in Newcastle County, and they can really contribute to lead poisoning, not just in the person, but their family members. And this slide here says firearms are considered the largest unregulated occupational and non-occupational sort of adult lead poisoning in the US, which exceeds lead paint. And that kind of makes sense if you think about how adults behave in their environment. We aren't close to the ground. We're not usually touching things, and we wash our hands presumably a bit more than kids, but we also have these other exposures that kids hopefully do not have. Just to go back to this slide for just a quick second, this was also something when people have been victims of shootings, it's recommended that they continue to get lead testing because at the time, obviously, the healthcare provider makes a decision to leave a bullet in the body based on its location, but that can slowly over time leach lead into the bloodstream and into the body. So it's something that people want to get monitored if they have any fragments in their body, just continuous monitoring. Maryland is really the state that I look at and I'm like, we can do this, because Maryland is small like us and they have just figured it all out. I feel like they have an amazing universal testing program. For 6 years, starting in 2015, it's still going on. they're testing everybody at age 1 and 2. They're going to find these high-risk areas, but they're going to do really good testing to find those high-risk areas. And this is in their plan for childhood lead poisoning. In addition, their housing model is amazing. In Delaware, if you've ever bought a home here or rented an old house, you know that you get that pamphlet, and I don't know what you're supposed to do with it. You just know that there's lead in your house. But in Maryland, they're really creative, and they have instituted an annual fee, which generates revenue for rental units. And then they also have to actually certify that the home is lead safe before it changes hands, which is really great. I've bought a number of homes in Delaware throughout my years that had not intact lead paint. And in Maryland, that is not allowed. If it's chipping or peeling, it does not pass a dust clearance inspection. And that's so important because people really are just trying to find a place to live, and they need to have some level of safety provided. I already spoke about this a little bit. There's the lead abatement program as of last fall. They're giving preference, obviously, to people with young children or pregnant women. Pregnant women are also a concern. It's not recommended right now by the American College of Gynecologists to test pregnant women, but people believe that they should certainly be surveyed and, to try to see if they have exposures. So there's the information if you're interested in it. And just to end, I just wanted to be really clear that environmental policy is health policy. This is all connected. Environment is not out there anytime that somebody says, that's the environment, that takes second place, that's this, it's not a priority. It's always a priority because, especially in this case, it's the next generation of children. It's people who are going to take care of us, and we really need to give them as many chances as possible to succeed and do well. And it's preventable. It's 100% preventable. So if we could figure this out, we could actually stop it for the most part, which is really exciting. And that's what makes me motivated to work on this, is that it is something that can actually happen.
Great, thank you very much. We did have a couple other questions that didn't particularly come up in conversation. We had one from Facebook that asked, is there any way that the body can sort of metabolize lead and pass it, remove it from the body by natural courses?
So one of the things that's really concerning about lead is that the worse your diet is when you're exposed to it, the more you absorb. So there's a lot of things that if you're deficient in them, you'll absorb more lead. So for example, diets low in calcium, people absorb more lead because it's kind of one of those things that mimics the other thing. So if you have a good amount of calcium, you can actually reduce the amount of absorption. You don't want to be in a position where you're doing that, but there are obviously cases of people who have to stay in homes where they know there's lead exposure. And one of the things is they really encourage a good diet, because having all those nutrients will reduce the binding in your body. It will reduce you absorbing it as much. Having said that, I don't know of anything about metabolizing it or how it gets excreted without somehow being stored in your fatty tissues.
Yet another reason to eat your dark leafy greens.
Yes.
And so is anyone tracking the impact of lead from the stay-at-home order due to COVID, particularly in low and moderate income homes?
Not that I know of. I hope they are, and I wish they were. One of the biggest concerns, and Dustin, I was so glad when you reached out to me, is a lot of people in the lead community are so concerned about kids staying at home right now in homes that maybe aren't healthy, lead-wise, and a variety of other reasons. But on top of that, lots of kids are missing their regularly scheduled appointments across the country. So we already have this, less than half of kids are getting tested, and maybe now even more kids aren't going to get to the doctor and not get their preventive care. So the answer to that is not that I know of.
And with those that have exposure, they're not able to get to the Head Start and early education that helps with kind of helping with that exposure.
And simultaneously, people are doing a lot of at-home projects, which are, a lot of people are concerned are kicking up dust while their family members are at home, and, resanding down old pieces of furniture and things like that, and really kicking up a lot of potential harmful things.
Yeah. So, well, I do want to thank you again. We could probably continue this conversation for another hour or so, I think. Yeah, so how can people get more involved in this effort with you? I see you have a lovely slide for that too.
Yeah, well, please click on our Facebook page. We put there, things that we're working on, if we're going to Legislative Hall, if we're going to meetings, anything, if we need people to write letters. Obviously, this year was pretty impacted by coronavirus, but we know next year things will probably ramp back up to some extent. So we've got a lot of things we're working on. So please follow us on Facebook. And you can always reach out to us on there, send us a message to Lead Free Delaware, and we'll get back to you.
Wonderful.
Join us. We need passionate advocates to help with this. There's a lot of ground to cover, but we're excited.
And of course, if you know anybody with children, talk to them about getting tested, right?
Yes, make sure, because the more people I talk to, they'll say, oh, they said it wasn't necessary, or
do it anyway.
It is. Yeah.
Wonderful. Well, thank you so much, Sarah. It's always, I love talking to you, and it's always great hanging out. Thank you also, Dr. Rowe, for all your work that you two do together. I know, Amy, I know you're on, so I want to acknowledge you. Thank you, everybody that's watching on Facebook. Please share the video, get the information out. We have a lot more live streams coming up over the next couple of months with a number of really great topics. Our next stream will be about the everyday chemicals, not excluding lead. We may touch on lead again, who knows. But the everyday chemicals that we come into contact with and how they can be harmful to us and our environment. And so we hope to see you there. Please RSVP. You can watch all of our previous episodes on our sierraclub.org/Delaware. There's a live stream landing page that you can watch all the old episodes on our YouTube page. So thank you again for tuning in, and hopefully we'll see you next week. Thanks again, Sarah.